This is the Wizard News for Friday, December 31st, 2021. Musical accompaniment by Robert Irving III. A new hospice agency in Nashville is focused on increasing the use of comfort care at the end of life by Black families. Heart and Soul Hospice is owned and operated by people who share the same cultural background as the patients they are trying to serve. In their application to obtain a certificate of need in Tennessee, the hospice owners made it clear that they are Black and that they intend to serve everyone, but will focus on African Americans who are currently underserved. Tennessee data show that in Nashville, just 19% of the hospice patients are Black, though they make up 27% of the population. Though the area already had numerous hospice agencies, regulators granted the permission based primarily on the value of educating an underserved group. National data shows Black Medicare patients and their families are not making the move to comfort care as often as white patients are. Roughly 41% of Black Medicare beneficiaries who died in 2019 were enrolled in hospice, compared with white patients for whom the figure is 54%. Mary Murphy's mother survived nearly 3 years in hospice. The benefit is meant for those in the last 6 months of life, but predicting when the end will come is difficult, especially with dementia. Hospice provides palliative care for the dying and support for caregivers for as long as the process lasts. Murphy did most of the caregiving, which can be overwhelming, but hospice helped with a few beds a week, medication in the mail, and any medical equipment they needed. And most important to Murphy was the emotional support, which came mostly from her hospice nurse. If you don't feel like, oh my God, thank God I have hospice, if you can't say that, then we're doing something wrong, said Keisha Mason, who is Heart and Soul's Director of Nursing. Mason, like Murphy, is Black and says that in her view, there is nothing fundamental keeping Black patients from using hospice except learning what the service can offer and that it is basically free to patients, paid for by Medicare, Medicaid, and most private health plans. I say to them, if you see a bill, then call us because you should not, she said. As Mason has helped launch this new hospice agency, she has begun using new language, calling hospice more than a Medicare benefit. She describes it as an entitlement. Just as you are entitled to unemployment, as you are entitled to Social Security, you are entitled to a hospice benefit, she said. The investors in Heart and Soul include David Turner, owner of CNS Hospice in Detroit, Nashville pastor, the Reverend Sandy McLean, and Andre Lee, who is a former hospital administrator on the campus of Nashville's Meharry Medical College, a historically black institution. Lee and Turner also started a black-focused hospice agency in Michigan and have plans to replicate the model in other states. Lee said more families need to consider home hospice as an alternative for end-of-life care. Nursing homes are pricey, and even with Medicare, a hospital bill could be hefty. Hospice research has not come up with clear reasons why there is a gap between white and black families' use of the benefit. Some speculate it is related to spiritual beliefs and widespread mistrust in the medical system due to decades of discrimination. The hospice industry's national trade group, the NHCPO, released a diversity and inclusion toolkit and a guide for how to reach more black patients this year. It recommends connecting with influential DJs and partnering with black pastors, but also just hiring more black nurses. Michelle Drayton of Visiting Nurse Service of New York says her large agency has been meeting with ministers who counsel families during failing health. Many of them did not fully understand what hospice was, she said. Whether it is an upstart hospice company or one of the oldest in the country, everyone still has a lot of end-of-life educating to do to bridge the racial gap, Drayton said. Source: Kaiser Health News, NPR, and Nashville Public Radio, December 28, 2021.